He would like to know if there is anything really we can consider it new in the fetal medicine, and we can tell people that now there is something promising in the way.
Well, the most important recent development is the examination of DNA in the mother's blood from the placenta, so that we can diagnose an increasing number of genetic conditions in fetuses. I think that is the most important from the diagnostic point of view. In terms of fetal therapy, there is a continuing research that started from more than 20 years ago on developing methods for fetal therapy.
Is there something we can expect it in future related to fetal medicine?
Well, I hope that there will be more access to all pregnant women to high levels of fetal medicine. So you have two things. You have continuing scientific developments, but there is always a big gap between the introduction of what we learn from scientific work into routine clinical practice. And I hope that through clinics like the King's Clinic, we will be improving the standard of care for the patients.
Many physicians, they relate many problems and anomalies and defects in neonates or in children or in fetuses relate to the genetic cause. To what extent we can accept that?
It is true that there are many genetic conditions that are responsible for abnormal development, and those conditions will increasingly be detected during the course of the pregnancy. But I think that there are also a lot of environmental factors that cannot be ignored.
Do you recommend anything can we follow here in the UAE?
I think the most important thing is to provide a high standard of care. The people that are well trained in providing that care should be accessible to a greater proportion of the population.
Thank you.
One of the problems of the UAE is that you have extremely beautiful buildings. There is a lot of wealth, but at least in my field, that has not translated into the provision of care to this population to a high standard.
Your lecture was mainly concerned about what today?
Well, we know that the health of children is a key prerequisite for enabling them to fully develop and flourish and to use the opportunity in their life. So we are very keen in supporting child health. We have many more opportunities today with improvements in diagnostic and therapeutic intervention. We can help a lot of children that have significant issues. But we're also faced with new issues and new problems. We see an epidemic of overweight and obesity in our childhood population. And it is really a big issue for their future because obesity results in diabetes, in heart disease, in some forms of cancer. And we know that children who are obese, particularly who have severe forms of obesity, have not only a reduction in quality of life, but they also have a shorter number of years they can live. So we are very keen to both treat obesity and prevent obesity. And we know that in childhood we have many ways to do that. We can try to help families to encourage physical activity on a regular basis, to limit the time where children sit in front of screens. And we can help them to take appropriate choices, have the children drink water instead of sugar drinks, have them eat fruit and vegetables on a regular basis rather than foods that are very high in fat and sugar. The really exciting news is that we have a window of opportunity very early in life when lifestyle choices and dietary choices matter for long-term health. And what I've talked today about is that we have found breastfeeding protects against later obesity. If women choose to breastfeed their baby, it can reduce later obesity by as much as 20%, which is a big benefit. In recent years, we've tried to understand why breastfeeding protects. There might be many factors involved, but one factor that we have identified is that breast milk provides less protein than the conventional milk formulations. And therefore, we've done a study in Europe in 5 countries where we have given to children either the conventional baby milk formula or a new concept of formula with less protein, more similar to breast milk. And we can see that we can reduce, by improved infant feeding, obesity at school age by almost a factor of 3. So we really recommend today that babies should be breastfed whenever possible. And if they're not breastfed or not fully breastfed, we aim for a bottle milk that is lower in protein than we used to have before. And we advise families not to feed babies with regular cow's milk as a drink, because the normal cow's milk has much more protein, 3 times as much protein than breastfeeding.
As I said this morning, the center is now going to be 50 years old, the King's College Hospital. Sheikh Zayed's contributions, engagement started in late 70s, 79. And that was a seed funding which has helped us to grow and develop many of the new treatments for the children and adults with liver disease. That time the contribution was mainly for adults, but that has helped children. Now we are moving to a second phase where children's health, liver disease should be focused and has its own reasons to grow. So we are working on that, and there is a second phase of development of laboratories is going on at King's College Hospital at the moment. And we would very much like that that partnership that we have to continue for future. What we particularly believe is that we all identify a disease, we see it, and as Kipro said this morning, you can see the face, you can see the features, you can say it. What we are more interested is what causes this disease, what's the mechanism of the disease. Once we know the mechanism, it's very easy to get new tests done and to treat it. That's the most important thing, and prevent it later on. So we are starting from mechanistic research which helps developing new treatments, and we have quite a few achievements in that, which has Sheikh Zayed Centers, the contribution that initially has helped us to achieve that, and we would like it to take it to the next step now.
As expert in hepatocyte transplantation and also liver transplantation, so do you want to say something about that? What's the new and what the contribution of King's in that type of practice?
Unfortunately, when the liver disease is advanced, the only treatment at the moment is change the liver, so replace the liver, which is liver transplant. But that comes with its own limitations. The organ's availability is very limited, and you need to have lifelong medication after that. What we have learned over years with our research is that you don't need a whole liver. Liver is very big amount of the enzymes and the function that we need. So what we learned and we practiced is that liver can be removed, and when it's removed, it can be processed, and we can isolate what we call cells. These are the functional units of the liver. And those cells, we can put those cells into the patients with metabolic liver disease, which is unfortunately particularly prevalent in this part of the world, highly more prevalent than others, and give that missing enzyme defect. So in order to avoid transplantation, that is one. And then also to use those organs which are not required for transplantation, go for others where transplantation is required. Our ultimate aim is to give the cells without requiring immunosuppression for long term. So there are phases are happening. So we were the first in the world to treat children with liver failure with cells put into small beads called allogeneic beads, and those children avoided liver transplantation. Some of them avoided liver transplantation and avoided lifelong problems of medication they would have otherwise. So for them, the liver disease never happened, in other words. So that is an achievement which we are very proud of, and that partly is contributed by the relationship that we had with your country.
Is asking about the center which King's established here, that is there any intent to implement the liver transplant program in it? Liver
transplant program is a big undertaking. I I think what we are going with a very measured approach, a gradual incremental approach rather than overwhelm with everything. So we want to have an incremental approach. When the time is right, expertise are developed. What we want is things done here. That's what we are aiming at. What we do not want is the patients to travel to London. So we are trying to change the model. We have experts from King's College and trained in UK or US or other countries, but at the same time, we will be providing we can't provide everything. So there may be some specialties where there is so much small niche. We will be sending people here so that people get the care here at the point of where they enter. That is the whole idea. But that is just patient care. We are going beyond that. What we want is a continuous professional development of the colleagues who are around in the region. So today's meeting is an example. We don't need to do this meeting for the clinic. What we need is to share the knowledge and have bilateral dialogue with people. It's not one-way street. So our aim is to improve colleagues' information and learn from them. So it's a bilateral process. The diseases that we don't see, our trainees don't see. So we think there's a mutual benefit for both sides. But the main things are we develop the facilities for people here at the standards which are international.
Yeah, Dr. Alistair Baker, they asked as a chair of British Society of Pediatric Gastroenterology and Nutrition, they would like to ask about the organization, the British Society. What achievements you think that you invited the British Society?
Well, the British Society of Pediatric Gastroenterology, Hepatology and Nutrition is also quite an old society. It's more than 25 years of age. We're going to have our 30th meeting next year. It has over 300 members, and it has a multidisciplinary membership, so that just under half are doctors, but just over half are specialist nurses, dietitians, pharmacists, psychologists, and many other multidisciplinary professionals who contribute to the overall care of children with liver and gastrointestinal and nutritional conditions and research. So it's multidisciplinary is the first thing. It's involved with the education of medical trainees and other professionals, and contributes to the Royal College of Paediatrics and Child Health training program. It has a big research interest, and in fact all the surpluses of the society every year are put into a research program, so that and every 2 years we put together 2 research calls, and we fund research for paediatric gastroenterology and liver disease in the UK. And in fact, Professor Dhawan is the recipient of one of those grants at the present time in nutritional care. It also, apart from those 2 things, it also has international connections through the European Society, and Professor Kolezko is the president. We also are looking to develop an input into standards for activity or professional activity in the UK. For example, endoscopy training, which is associated with the British Society of Gastroenterology, has a new set of standards, and we're developing them for paediatric endoscopy, including for consultants. So as you can see, we have a very diverse portfolio of professional activities for all our members, but we focus particularly on the care of the patient. So that's what we're interested in. How do we put together professional activities to ensure that patients receive the best possible care? And one of our other principles, which is relevant to here, is the principle of as close to home as possible. Patients with chronic illnesses of any sort do not want to travel around the world to get a high standard of care. They want it as close to home as possible, and that's one of the key principles of our society.
What you would like to say from the conference which held now here, is there any recommendation you would like the media really to take?
I think it's an educational one, and I'm only echoing what has been said by other speakers, that the message I would like to get out is that association between doctors and other professionals locally and internationally about the care of children with liver conditions is essential. That we set high standards and we all understand what they are. around education, around research, around clinical practice, and we discuss them and we adhere to them.
Is there any plan how can we really work together and more cooperation or collateral works with the region here?
Absolutely. The European Society for Pediatric Gastroenterology, Hepatology and Nutrition aims at promoting child health with a focus of enhancing gastrointestinal, liver and nutritional health. And we do that basically with two key elements. We try to improve our knowledge base by enhancing research and science, because we know what we do today is a result of the research of yesterday, and the research of today is the child health care for tomorrow. And the second element is improve the standards of practice, improve accessibility to specialist care for children, which is so important. We see again and again that children with a chronic gastrointestinal or liver problem who go to an adult physician cannot get the same level of care, because children are not small adults. They have very specific needs. For example, growth is affected by a childhood disease. We need specialists in pediatric gastroenterology and liver disease to take good care of children with these disorders. We don't have enough of them, and that's why often children are getting sort of the second-class care by people who are not specialists in child disease. We need to enhance the standards of training. We need to work together with our colleagues here in the Middle East to exchange knowledge, to get the same level of standards established here as well. And I think we are on a good way forward. We see at our conferences of ESPGHAN that a lot of doctors from the Middle East are attending, which is very encouraging. There's more and more collaboration. The example of King's is one good and glowing example that the collaboration between centers in different parts of the world really can help to move things forward. And that's what we would like to do. We offer fellowships so that people can come and visit and work with us. We are happy to send our colleagues to this part of the world, and I think that is what we ultimately try to achieve, getting the best level of care for all children.
Thank you. Yeah, he's asking about the possibility of diagnosing anomalies in the fetus early, and if there is any chance to interfere as a therapeutic measure to correct these anomalies.
For many years now, there have been intrauterine interventions to reduce the damage from certain fetal abnormalities. The biggest challenge is actually to have a high standard of ultrasound examination throughout, so that these abnormalities can be diagnosed early, and then they can be referred to specialist centers. From my point of view, we have a network of training. In London, the Fetal Medicine Foundation is giving 90 scholarships every year to people from all over the world to come and train. So one is to do research to diagnose conditions. Two, perhaps more importantly, is to pass on the knowledge from this research so that it becomes a clinical service throughout the world. And then super specialist centers that can do fetal surgery.